And Dr. Mark Crispin from Crispin Plastic Surgery has been helping his clients look and feel their absolute best for more than 2 decades now. He's joining us today to talk about breast augmentation, and he's brought along a very satisfied patient, Alexandra Smith. Welcome back to you, Doctor. And Alexandra, welcome. Thank you for being here. We're going to get to your story in just a minute, but I want to talk to you, Doctor, about breast augmentations. I know this has been a popular procedure for many, many years now. Talk to me about how long you've been doing them and how they've really evolved.
You know, I've been doing this now for 20 years, which is hard to believe.
Yeah.
But for 20 years, I've been doing breast augmentation here in Atlanta.
Wow, incredible. I know that, would you say that over the years, you know, I know for a long time ago, they stopped using the silicone, but now silicone is back, it's fine. Talk to everyone about the differences.
Well, there are all sorts of different kind of implants, and that's really good because you need to customize the implant and the result to the patient.
Right.
First of all, you have to ask the patient what they want, and frequently they want a natural look.
Right.
And the good thing about these different types of implants, you can fit the base of the breast appropriate for the implant,
right,
and give people what they want, which is more of a natural look these days.
Right. I just had a girlfriend who's thinking about it. I'm going to tell her to call you. Maybe she's watching. We were talking about it's hard for somebody to say, what did you get or what's up? Because everybody's so different, right? And in terms of, you know, maybe you're kind of short but have broader shoulders, or you could carry it well. And that's where they come to you with your expertise over the years about what will look best for you, not anybody else, but for you, right?
Absolutely. Yeah, people will bring pictures in, and that's helpful, but you can't duplicate one breast to another. So, but it's a good starting place, and most of all, if you listen to people, they'll tell you what they want. You just have to listen to them. Exactly,
and that's nice. So you don't kind of impose. You can tell them what you've experienced in the past, but you're not going to tell them what to do.
No.
You know, they come in with their ideas, and you go from there. And tell me about these new Gummy Bear implants.
Well, these are new exciting implants. They're implants that are made out of silicone gel, but the gel is thicker, so that if you have a really skinny patient who doesn't have a lot of coverage, you're less likely to see contour issues and problems that we've seen in the past.
Right. I can't stand when you can see something all of a sudden it just looks like a hard, like a cantaloupe.
Right.
Lump.
And a lot of times those other old implants had a really high sort of tall look to them, where you had a shelf deformity, and these implants don't have that. They have a nice taper and teardrop shape to them.
Right. Beautiful. And Alexandra, what made you decide to do this, and most importantly, see Dr. Crispin?
You know, it's not something I ever thought I would do. Some people know that they want to, at one age, have a breast implant. Right. But it wasn't until after having 2 babies and breastfeeding, I think a lot of women can relate, your bodies change, and that's one thing you just can't get back sometimes.
Exactly.
And so that's when I made that decision, that confidence, I think I would be fulfilled by looking into it. And I did. I met with 4 different surgeons, Dr. Crispin being one of them. I was worried it might be something that I'd be confused with, but he, hands down, was the doctor I wanted to go with. Him and his staff, they listen to you, what you're looking for. They take the time. You never feel rushed with Dr. Crispin. But at the same time, he listens to what you want, but he will give his expertise, like you mentioned, about what's going to also be healthy and safe for you.
Right. And how did you find the whole procedure? It went very well, smoothly. You look incredible.
Thank you.
If I may say so.
Thank you. It really did. I've been very pleased with my outcome. The follow-up care from Dr. Crispin and his staff was great. He's a perfectionist.
Yeah,
so
good.
He strives for that. So
good. And so, Doctor, I know we brought along some other befores and afters, and we really want to talk about what we're seeing here, because again, every body type is different. Everybody's before is going to be different. So talk to me about what we're seeing here.
Well, here's a before picture on a patient who's interested in breast augmentation. He has a relatively symmetric breast, which makes my job easier.
Right.
And here she is afterwards.
Wow.
So she has some superior pole fullness, not a lot. She looks nice and natural. Most of all, her implants don't mushroom out to the side, which is real artificial looking.
Right, right. Okay, beautiful. I mean, in clothes, I'm sure she looks amazing, but also in a bathing suit, as you said, it's not like something's coming out under her arms. It just looks so natural.
Exactly. Here's another lady with a different shape to her breast. This is her preoperative picture.
And then
here she is afterwards.
Beautiful.
Again, with a nice natural result. The implants don't have to be huge. They can look very natural.
That's what I was just going to say. Are you finding more and more that women are like Alexandra and myself, that are saying, gosh, after 2 children, I just want to look like a younger version, you know, the way I used to look. I don't want to look like a, you know, Playboy playmate.
Exactly. They just want some superior pole fullness, which you can see in this picture, where she's just had the skin envelope filled up.
Wow, that looks just beautiful. And again, natural, because that's the look, the aesthetic that you really go for and that you really encourage in your patients. And talk to me, Alexandra, if there's anyone out there who's considering it but maybe a little bit frightened, what would you say to them to say, hey, go for it?
I've always thought if there's something out there that's going to make you feel more confident, that's safe, go for it. And I absolutely would recommend, if you're going for breast augmentation, to come and meet Dr. Crispin.
Absolutely. Dr. Crispin, I know you have also a great offer for Atlanta and Company viewers, so tell us what that is.
We do. Well, I'm fortunate enough to have a busy breast augmentation practice, so the implant companies give me a better rate on the implants. We'd like to pass that on to the to your viewers.
Good.
And so for until the end of the year, we're going to allow $500 off breast augmentation.
Fantastic. Until the end of the year, and one of the things I've learned from Dr. Crispin is, ironically enough, I would think that as we get into the holidays, people aren't doing anything, but it turns out this is a really busy time.
It's a busy time, very busy.
Because people are taking, have their little vacation days, and they're thinking, I'm going to do something for myself and look good for those holiday parties. So take advantage. That's a fantastic special, $500 off through the end of 2015.
Yes.
Thank you, Dr.
Thank
Alexandra. Thank you.
Thank you.
You look amazing. And you can also, if there's anything that you want to talk to the doctor about, just don't hesitate. Pick up the phone, give them a call, 404-257-9888, or log on to crispinplasticsurgery.com.